Recording in progress.
Hello, everyone. Welcome back to this week's episode of The Broken Brain. It's me, Dwight, your host, here once again to talk about the intersection of culture, psychology, treatment, and knowing what's up. That's what we're focused on today, is focusing on how do we know what's going on with us and how do we use that information and just some other aspects of treatment. I have a wonderful guest here today with a lot of experience in that area with both clinical and assessment and research into this area of the field. Dr. Barry Herman is a medical doctor and the chief medical officer for Mentavi Health, and has done just work over the years with clinical mental health and finding ways to assess ADHD as well as other things for mental health assessment tools. And Dr. Herman, thank you for being here today.
Hello there, Dwight, and thanks for having me on your podcast.
Can you tell people a little bit about yourself and maybe what it was that pulled you into this strange field that we find ourselves working in, and
well, sure.
Your specialty?
As you said, I'm a medical doctor. I went to medical school at Tufts University School of Medicine in Boston, and then I trained in psychiatry and finished a child and adolescent psychiatry fellowship at Stanford. I then embarked on a career in clinical practice for about a dozen years before having a transition, if you will, in my career, what I call my encore career, where I went back to school, got a business degree, a master's in medical management at Tulane, and then embarked on what has been now over 25-year career in industry, starting out in the insurance industry for a couple of years. And then I spent 25 years in the pharmaceutical industry and basically worked for a number of companies over the years, characterized by increasing roles of leadership and responsibility. My last job in pharma was with a company called Tris Pharma, and we had a portfolio of branded ADHD medicines. I've been in the ADHD and related disorders space in pharma for about 10 years. Mm-hmm. The last 5 years of my career have been spent in digital health. And for the last 2+ years, I've been the chief medical officer, as you said, of a national telehealth company called Mentavi Health.
Such a growing part of the field, especially as we went through the COVID times. And I think it's those of us who have been working with telehealth or online sessions before COVID, which I did. The podcast helped me to get used to that because I was used to talking to people on video. But any of us who did it before then noticed, I think, a boom in acceptance of that or knowledge that it even exists. It just, I don't know if you experienced that, if you were working there over the COVID times.
Absolutely. I mean, the technology for telehealth has been around for decades, actually, but it was really COVID that provided the tailwind for accelerating the use of telehealth for increasing access to care, especially at a time when access was really very difficult.
Mm-hmm. Yeah. It's also just the people knowing how to get on a thing. You know what I mean? Just the saying, like, that was intimidating to a lot of people before, of like, what program do I use and how? And it's like, now we've got the healthcare approved version of Zoom versus the Simple Practice or some of those. Not a sponsor, by the way. I don't know why I mentioned. I don't mean a buzz market for different, but there's a lot of tailor-made programs that are like, just click here. That's all you got to do, instead of like, let me download a program and create a profile and everything. So it's a cool time for the field that way. Well, so I mean, access to care as well as people getting the right diagnostic information, those kinds of things, obviously a big part of your work. What was it that caused you to focus in on ADHD?
Well, I'm a child psychiatrist, and probably the bread and butter of my clinical practice really focused on neurodevelopmental disorders like ADHD. It was a big part of my clinical practice, and I specifically worked with school-age children for whom ADHD often brought them to my office. So my career has always been kind of grounded around neurodevelopmental disorders like ADHD. And then it was almost by serendipity when I got in the pharmaceutical industry that I landed in the ADHD space, particularly in the latter part of my career in pharma, maybe 8 to 10 years. I found myself focused on ADHD and related disorders.
Yeah.
It was a good fit. It was a good fit for me.
It's also one of those things that from a lot of the research that I'm aware of too, the pharma component for ADHD, the medicine component, you got a couple of those disorders out there, bipolar disorders one, but ADHD, to where medicine makes a big difference, even more than therapy, and even more than therapy and medicine coupled. Even if you're only on medication, you benefit. So, I mean, having that assessment to see, am I really going to it makes a big difference in the treatment, I think.
Yeah, for sure. Medication is really the first line treatment, especially for anyone over age 12. For younger kids, we typically will begin with non-drug treatments, try working with parents in what's called parent behavioral training,
right?
Work with kids and helping them to get more organized and provide structure for them. But in general, once somebody reaches the age of 12, the recommended first-line treatment is medication. I always recommend a combination of medication and some kind of behavioral therapy, even though, to your point, many people are just treated with medication. Medication alone is really not enough. You really need support, and that comes in a couple of different ways. One is the kind of behavioral therapies that are available right now in traditional psychotherapy, but also coaching. And ADHD coaching has become really a big, burgeoning industry, and has been part of an overall comprehensive treatment plan, and particularly for older people. The older you get, the more you really can benefit from what coaching has to offer. So even on our own platform, we offer a combination of medication and therapy and coaching to our patients.
And it's interesting because I know that the term coaching attaches to all sorts of different things, but I've noticed the same thing, like the ADHD coach. It's showing up more in how people are sharing what they do, if you look at online ads and stuff, or just the requests coming in. And I feel like something's arrived when people have heard of it and start asking for it. Like, do you do this? Do you do that? I'm curious, what do you see as a difference there between just the traditional therapy and specific ADHD coaching?
Well, coaching is not therapy. Coaching is really not therapy. It's, in fact, it's definitely not considered to be therapy, but how it can help patients with ADHD who really often have difficulties with what's called executive functioning. And that's higher order cognitive processing, like planning, organization, different types of working memory. These are the things that people with ADHD at all ages have to deal with. And coaching can really be a big help for that. It can really provide tools and structure and resources for patients with these executive functioning difficulties, and help them to be able to learn how to become more organized, to be able to plan, to be able to be more ordered in the way that they structure their lives. And it's really providing a kind of scaffolding that they can rely on, tools that they can utilize to be able to really deal with the difficulties that are that go along with having ADHD.
Mm-hmm. Yeah. I know when I have bipolar disorder. When I was first diagnosed, it made a tremendous difference when I started taking mood stabilizers. Tremendous difference. However, it also then, with the therapy component of my own treatment, I noticed that what I needed a lot of focus on was the habits, unconscious, maybe an automatic thinking that I developed over years of coping without knowing that I had bipolar disorder, coping with the symptoms. And once some of those chemically induced like symptoms were stabilized, I still had to practice I was reacting to the world differently when I had mood irregularity. And so I have to get used to how do I think about it. But it gave me that edge to be able to notice that I was doing that. Does that make sense? Is that
Absolutely. And being able to achieve a level of self-awareness is very important part of that, and becoming more aware of the issues that you're kind of having to struggle with, and giving you some tools once you have that insight can be enormously helpful.
Mm-hmm. Well, I'm always fascinated by the way that we categorize these things. When we look at the development of diagnostic tools and even the concept of symptomatic diagnosis, right? You look at how those things have changed over time. And of course, we're still gathering information that helps us, hopefully, to make those classifications and diagnoses as useful as possible, right? And of course, one of the things that's difficult about psychological disorders is many times there's not the same type of testing we're used to. For if I get an x-ray, I can tell a bone is either broken or not. If I take a blood test, I can tell what my cholesterol is, or they can. I don't know how to do it at home. But anyway, and we have a lot of times where this is observable, behavioral, self-reported. I mean, all those kinds of things that make it difficult to get good information. And unfortunately, a lot of times we don't have people go through like a really official process, right? We just go, sounds like it, stamp. So I'm curious, as you have approached that in your career, what have you seen about diagnostic techniques around ADHD and other things?
Right. Well, specifically for ADHD, we really totally rely on the diagnostic criteria that are established in the DSM, what's called the DSM-5. You're familiar with that. It's the Diagnostic and Statistic Manual of Mental Disorders. It's published by the American Psychiatric Association. And over the years, the diagnostic criteria for ADHD have changed somewhat. Even the name of the disorder has changed. It used to be called hyperkinetic syndrome, just ADD, or attention deficit disorder. Eventually is involved in what we now call attention deficit hyperactivity disorder. And there are specific criteria that have been established and field tested to try to validate those criteria. But what you said is like really the most important piece of this, which is currently for ADHD, there are no what we call biomarkers to be able to establish a diagnosis, meaning there's no blood test, there's no genetic test that you can take, there's no imaging study of your brain to be able to show what would be consistent with the diagnosis of ADHD. Actually, at this point in time, the current standard of care for diagnosing ADHD is a clinical interview. Now, you're right. We do have some scales and screeners that we utilize, but at the end of the day, the way to make a diagnosis of ADHD is to have to be interviewed in a clinical interview by a licensed professional, mental health professional, who is relying on taking a history, getting as much information as they can from observation. They can get collateral history from people in that patient's life,
Mm-hmm.
whether their parents, their siblings, their children, their
Even a spouse
coworker,
at times, right?
spouse. Yeah.
Hmm.
And at the end of the day, they're relying on the DSM-5 criteria to establish a diagnosis. That is the current standard of care. And in other areas of psychiatry, we're getting closer to having biomarkers where we can actually, look at brain imaging, for example, and then we can tell whether someone has dementia or not
Mm-hmm.
from the structure of their brain. We're not there yet with a lot of diagnoses, including bipolar disorder, major depression, anxiety disorders. So typically, we're at the stage now in the evolution of mental health assessment and treatment where we very much rely on clinical judgment of licensed professionals who are utilizing the DSM-5 for establishing diagnostic criteria.
What do you feel like are some of the benefits or the advantages of having that clear diagnostic information?
Well, it gives everybody, it creates a level playing field in terms of what somebody means when they give somebody a diagnosis.
Mm-hmm.
I mean, if you didn't have that, if you didn't have established criteria and you hadn't field tested them for validity, then you could basically label somebody anything. Mm-hmm. And nobody, and whatever that label was could mean something different to different people. Mm-hmm. Once you've established diagnostic criteria, at least there's a framework that's consistent and that everyone understands what you mean when you say someone has major depressive disorder, somebody has bipolar disorder, somebody has PTSD, somebody has ADHD. Mm-hmm. There are established criteria that every mental health professional really understands.
And of course, it strikes me too with the especially if you're dealing with something that is going to most likely lead to a referral, at least a referral for assessment, or in your case, directly because you're a medical doctor, prescription, right? And if it's something that has been shown to benefit from that, it's even more important to. I feel like there's a trend in sort of humanistic philosophy. I don't know if anyone calls it that anymore, but the more humanistic that look at like, what are they almost look at diagnosis as a burden or a shackled in to say, let's not put people in boxes and everything. And while I think that individuality is super important in treatment, I still feel like, having a framework of saying, especially in those cases where this diagnosis is going to benefit from some very specific things that I might not do with someone who is just depressed or something like that. I shouldn't say just.
Absolutely. And, we truly believe that mental health conditions are brain disorders. We just haven't developed the science and the technology now to be able to establish those biomarkers, if you will. But we will. Yeah. We're getting closer and closer every day to being able to get there in terms of the precision that will be involved in being able to make diagnoses on an individual basis. And whether that's going to be through genetic testing or through, some neuroimaging study or combination of different biomarkers, mm-hmm. we will get there. And so I think the field is anxiously awaiting that to happen. Yeah. First of all, to your point, mental illnesses are still stigmatized because we don't have the same kind of biomarkers that we do, say, for high blood pressure or for diabetes or for cardiovascular disease. You can't just take an X-ray, or a blood test and be able to establish a disease or disorder right now. And I think when we get there, when we get to the point where we understand the biology that's behind these disorders, it will more legitimize mental health issues, but it will also obviously contribute to improved treatments for these disorders.
What are some of the challenges of narrowing those biomarkers down with mental conditions?
Well, mental illness is just a complicated business. You know, I mean, really, the prevailing thinking right now is that there's some combination or contribution of both genetics and environment that contribute to mental illness. I mean, for example, you can have identical twins, one of whom has schizophrenia and the other doesn't. How can someone with the exact same genetic makeup, have be different in that way? And it does speak to the fact that environment has a profound influence on the development of these disorders, whether it's mediated by what's called epigenetics, meaning it actually changes the structure of your DNA over time, or it just in and of itself, because of unique experience and the unique way that people experience, for example, trauma or resilience to stress, it can have a different impact on different people. So it's complicated business, and what we know about these disorders, because there's been a lot of work that's been done now in genetics, and what we know is it isn't just one problem with one gene; it's a combination of problems with multiple genes that are contributing to what is, called mental illness now. And it's going to take a while. You've got millions of different combinations of genes, and it's going to take a while to sort these things out. And then you lay on top of that the fact that environmental factors are going to play a role, or they're going to play a part in contributing to mental disorders. It makes it very complicated.
It reminds me, as you're saying that, years ago, I worked as essentially a behavioral consultant for a school program, a preschool and school program for young kids. And I would come into classrooms and provide insights and whatever, and observe how things were going. And I remember that we had a case of identical twins who had both come from an environment of just very severe abuse at a very young age. And it's interesting because a lot of times with kids, you've got this reactive attachment problems, right? Of like, and they divide those, of course. I know you know this. For everybody out there who may not, you have primarily inhibited types of attachment or disinhibited. I guess basically like either I don't attach or I attach, but in a shallow way that people may not notice that I'm not really attaching because I'm
or anxious attachment. There are different ways that attachment can be disrupted.
Yeah. And one of the things that was really fascinating was to see that these two kids, once again, identical genes and even identical abuse, or at least, as far as we know. And they each had the different, like very different types. You had one that was very anxious and withdrawn and wouldn't attach and would push people away and lash out. The other one was charismatic, as you'd think. And you would almost think like, they're doing way better. And it was like, but if you really watch, it was like they weren't doing way better. They just had and so to see them both have this completely different type of interrupted attachment was always very interesting to me to see. Here's same abuse, same genes,
Exactly. Sorry to cut you off there, but
no, you're good.
It does introduce the idea of resilience and the fact that, some people have extraordinary resilience to traumatic events or adverse experiences in their life, and others don't. And the outcomes can be vastly different, even, with similar kinds of trauma. The way that people process or handle it or manage it can be very different.
You mentioned how obviously clinical interview with knowledge and experience is the biggest factor in accurate diagnosis. But that there are tools that people use to gather, because tools are meant, of course, to gather information that is then assimilated and interpreted by the expert, right? Or do you see any particular kind of instruments or tools that you and this I think is useful for people when they're going to get assessment, is saying, what am I being administered? Or for those out there working in the field, what do you know of any or have recommendations, I should say, on what you think are good methods or tools to gather that information?
There are dozens and dozens of screeners and diagnostic scales out there for almost every single mental health condition that you can think of, and many of them are what's called validated, meaning they've been tested and standardized against a large population, and so they're quite reliable from the standpoint of actually contributing to helping make a diagnosis. Many of the scales are focused on the severity and frequency of symptoms related to a particular disorder. Many of them are used for clinical trials to be able to show the impact of treatment, in this case with a medicine, on the outcome of a disorder from the standpoint of the severity of symptoms, severity or frequency of symptoms. In the ADHD world, there are a number of validated scales that are out there that can help clinicians. And a number of them, I think you had mentioned this earlier, are self-reported scales that actually patients can fill out themselves, or you can have a parent or a caregiver fill them out for collateral information. But the scales, by and large, by themselves, are not sufficient to be able to make a diagnosis. They help, but they're not sufficient. And that's actually related somewhat to the work that I've been doing this last couple of years at Mentavi Health. Mentavi started out as a company called ADHD Online, and it was developed specifically to assess patients who thought they might have ADHD. And ADHD Online developed a online, what's called asynchronous assessment, meaning a user could actually get assessed online without having to talk to a clinician, and they could do it on their own time, 24/7.
Yeah.
And over the years, the company really expanded its focus beyond just assessment, but also included treatment of ADHD as an option for patients who were assessed and found to have a diagnosis of ADHD. And then ultimately, the company expanded its brand, if you will, to a broad range of mental health conditions, still somewhat focused on ADHD, but also focused now on the commonly occurring conditions with ADHD, like anxiety and depression. In fact, about 80% of patients with ADHD have at least one additional psychiatric disorder. So Mentavi Health became the brand, if you will, for diagnosing and treating a variety of mental health conditions. And over the years, including since I joined the company 2.5 years ago, we've been enhancing and improving the diagnostic evaluation, not just around ADHD, but also around these other comorbid or associated co-occurring disorders. And what we saw was that more and more people were starting to use telehealth. People love telehealth. Patients love it. Providers love it. It's convenient. You can do it in the comfort of your own home. You don't have to drive an hour and then find parking and then drive another hour back. I mean, it's a huge time inconvenience.
Plus, it
saver.
It broadens out accessibility too. I know I have clients who live hours away from. They're still in the state where I practice, but they live hours away from where I'm at, and they gravitated towards my specialties or whatever, and it gave them more choices, and also allows me to be able to see people who I mean, what, an hour and a half drive plus an hour session, right? And you're looking at like a 4 hour commitment once a week. That's tricky, especially I think there's the old challenge. You get, and particularly therapists who've been around long enough, they got plenty of referrals, and maybe they have a name around locally to where then they start to change their hours. So it's like, I'm working, if I got plenty of people, I'm working mostly daytime when I'm working. And so if I'm at work, and I want to see my therapist, and I can close if I have an office or even my car, and I can have a weekly session that doesn't require me to take 3 hours off work every week, then
that's absolutely right. It's not just patients who are geographically remote, but there are lots of other social determinants that create barriers to access to treatment, and especially cost, for example. And with the current workforce shortage in mental health, it can take 6 months to get in to see someone. And so this improvement in access is really the mission of our company. It's really to be able to provide accessible assessment and treatment at an affordable cost to anyone out there, anyone, anywhere. And so what we saw was that a lot of people were utilizing telehealth services. In fact, a recent U.S. Centers for Disease Control and Prevention report that came out just this year showed that 46% of adults were utilizing, with ADHD, were utilizing telehealth services at least once. And that's a lot of people that are utilizing telehealth services. And at the same time, no one had actually demonstrated that an online assessment was valid. Because remember, the current standard of care is a clinical interview with a licensed clinician. And no one had actually done the work to be able to demonstrate that getting assessed online without having to talk to a clinician was just as accurate as a clinical interview, which is the current standard of care for diagnosing ADHD in adults. So we set out to do just that. And we worked for about a year in developing and conducting a clinical trial. And that study was completed at the end of last year. And I'm happy to say that the results of the study showed that our diagnostic assessment was just as accurate as the current standard of care, which is a clinical interview. And so we actually showed that in some ways our diagnostic assessment was better than a clinical interview. In other ways, we were more conservative than a clinical interview. What we did see, though, is that there was a high concordance rate. We had what's called 80% sensitivity, which is pretty darn good, with a positive predictive value of 95%. And we had very low number of what are called false positive diagnoses, only 12%, compared to over 50% false positives in diagnostic assessments that are conducted by clinicians in a clinical interview. And that means if you get a diagnosis of ADHD with our assessment, you have ADHD. The weakness, if you will, or the limitation on our side was that we were overly conservative in diagnosing ADHD, meaning if there was any doubt at all, we basically defer to diagnosis and recommend further evaluation in order to establish a diagnosis. Now, that's exactly what you want to have happen. You don't want to be diagnosing someone that doesn't have the disorder. And if anything, a lot of the online platforms are being accused of making it too easy to get a diagnosis of ADHD. We saw exactly the opposite of that. And a lot of the online platforms were being accused of being pill mills, just a way to be able to get patients stimulant medications, which is the treatment of choice for for ADHD, but also comes with risks of abuse, misuse, and what's called diversion, meaning giving your meds to other people.
Right.
And so what we were able to show with our diagnostic assessment is that if anything, we underdiagnose, and we certainly can't be accused then of overprescribing stimulant medicines for those patients who end up getting treated on our platform. Now, the data for our study were initially presented at the World Congress of ADHD in Prague, Czech Republic, in May. And that's a gathering of like all the key opinion leaders, researchers, academicians, clinicians in the ADHD space. So all come together and share the research and provide the latest and greatest updates on diagnosis and treatment of ADHD. And then just in the last 2 weeks, our study, the clinical study, was published in a peer-reviewed journal, the Journal of Clinical Psychiatry, which is a well-respected peer-reviewed journal. So we're really proud of that. And we think that this study is going to really move the field forward for both diagnosing ADHD in adults, but also for telehealth in general, to be able to establish that an online asynchronous assessment can be just as accurate as a clinical interview is really a big deal.
Yeah.
And it was a big deal that we sort of had the guts, if you will, to be able to be confident enough that our assessment was that accurate, and to do the research to be able to demonstrate it. I'll add one caveat to this, Dwight, if you don't mind.
Of course.
And that is that currently there are no treatment guidelines, official treatment guidelines for adult ADHD in the United States. It's almost impossible to believe, but there are guidelines in Canada, in Europe, in Australia, but there are no official treatment guidelines for both diagnosis and treatment of ADHD in adults. And so the field has become somewhat of the Wild West, where people are just kind of doing their own thing because there's no evidence-based treatment guidelines that are out there, at least in the United States. Now that's being addressed right now by an organization called APSARD, the American Professional Society for ADHD and Related Disorders. And they've been working on this for a couple of years. And we expect that those guidelines are going to be published probably the early part of 2026, if I had to guess. We've just been anxiously waiting for this to happen. But I think a study like ours really adds to the body of evidence in terms of, what are the best practices for diagnosing and assessing ADHD. Now, I have to add one caveat where, we're a digital assessment. You get assessed online, answer questions. Our assessment is proprietary. It's dynamically modeled, so every patient's journey through the assessment engine is going to be different because every question that's asked is predicated by the answer to the previous question. So theoretically, someone could answer 400 questions in an assessment. No one answers 400 questions, but there are 400 questions
the program
out there.
will tailor. Right. Okay.
That's right. And what's nice is that patients can do it on their own time, 24/7. They can access it. They can, if they can't finish it, they can save it and come back to it. They don't have to talk to anyone. It's really ideal for providing that kind of access for people who really wouldn't otherwise be able to get, assessed, for any mental health condition.
It strikes me as useful also in the environment that we have now, where there's so many things online. Like, we live in this great time where there's so much information available. People can actually, there's a line though, they can self-educate themselves about a condition or the potential of a condition so they know what to look for in treatment. That's, I think, very helpful. But then we also have this sort of like occurring problem where you cross the line into self-diagnosis, and it's like, okay, I'm just going to now assume I have this and start a TikTok channel telling everyone what to do with the ADHD
That's
that I
right.
think I have too. And I might, but I might not. Or what if I have something else that's a misdiagnosis, maybe easier to do when I don't have any diagnostic training. Do you know what I mean? Do you see that that element of self-diagnosis using very like scant online tools, or
Yeah,
someone just
absolutely.
reading the DSM and saying, "I think that's me"?
Yeah,
Yeah.
absolutely. And there's a tremendous amount of misinformation as well, on the internet. As much great information as there is, there's also a lot of misinformation. And to your point, self-diagnosis, you know, is potentially problematic. I know when I was just starting to go to medical school, I was diagnosing myself with everything in the book
Sure.
that I was learning about. And you can see how that can happen. And there are companies out there, frankly, that are not good actors. They're making it easy to get a diagnosis or to get treated without really, being rigorous and having the right degree of clinical oversight. And that was important to us. We really wanted to lay down the gauntlet in terms of being able to establish the evidence behind what we were doing and challenging other companies to do that too. We want to raise the bar so that treatment online, is evidence based, and not everyone is doing that, and we know that, and it's really important, I think, to from not just from a good quality clinical practice perspective, but from an ethical standpoint, to really rely on evidence, scientific evidence, to be able to inform clinical decision making.
Yeah, bringing that science into, and it's such a, like I say, a kind of a humanistic philosophy that involves, and that actually is beneficial to people when it comes to therapy, because once again, we are such a it's like service focused, like need focused, individualized, helps people with their treatment. But then on the other hand, I think, make a mistake of interpreting psychology as a completely soft science, when actually you look into a lot of the research that's been done that is, more quantitative, and we're able to find observable things. And so I like that whole scientist practitioner model, where we're able to actually bring things that we actually know, instead of just what I think will probably work and be swell. So
Absolutely.
it's
And I
great
mean,
work.
that's important to us. We want the good housekeeping seal of approval as a company that's really doing business the right way.
Yeah.
And that's I'm chuckling when I say that, but we're really serious about this. I mean, we really truly believe that telehealth serves an incredibly important purpose in meeting these unmet needs out there that exist in access and treatment. We don't have enough mental health clinicians to meet the need, so we're going to have to rely on technology to help us. And telehealth, obviously, is a big technology-driven tool that we can use to be able to get there. But it has to be science-based. There has to be rigorous clinical oversight. Patient safety has to be at the front and center. And also, we want to be able to measure what we do. So at our company, we're really moving toward what we call a performance-based and a measurement-based approach to treating patients who choose to use our platform for treatment. I will mention one more thing. We've completely decoupled assessment from treatment, meaning patients can come to our platform and get an assessment, and there's no obligation whatsoever to go beyond that. They can take that assessment, it's portable, they get a really nice report, and they can take it to another clinician, they can get an accommodation letter for it, they can use it in a variety of different ways that they need it for, but there's no obligation to get treated on our platform. And I think currently about 45% of patients who get diagnosed on our platform end up getting treated by us. But there's absolutely no obligation whatsoever. There's no incentive for us to diagnose or not diagnose ADHD or any other mental health condition when we've decoupled the two like that.
That's a great practice. Well, it's great work that's being done. I want to give everybody information so they can access and find where to go. Before we get into, before we mention where they find you and your company online, I always like to ask guests if they have something that they would like to share. As people who listen to the show know, we like to highlight charities and nonprofits and other ways to give back to the world. Do you have anything that you would recommend? It doesn't have to be related to what we're talking about. It can be anything at all that you would recommend to people.
There are two organizations that come to mind for me that are very near and dear to my heart. One is the American Foundation for Suicide Prevention, AFSP. It's a wonderful organization that really has focused on prevention and reducing suicides in this country, and really reducing the stigma that are associated with suicide. And they've done a lot of great work raising money and using the money for research in this area. In fact, I think just this week was the Suicide Prevention Day worldwide, and so this organization is really a wonderful organization, and people can access that online. The other organization that I know something about and was involved with for a while is a organization called Project Healthy Minds, and Project Healthy Minds is a millennial and Gen Z driven company that basically was developed to provide a roadmap, if you will, for being able to access services and for both assessment and treatment. It's like the Expedia of mental health, meaning you get online and they can ask you a series of questions, and based on your profile, they can recommend what the next steps are for you. Yeah, it's a really cool organization. I think they're an organization to keep an eye on. They have a wonderful board of directors and clinical advisors, and like I said, this has largely been driven by younger folks, Gen Z, millennials, and I recommend them strongly for anyone that's looking for, information, not misinformation, and help. I strongly recommend that they take a look at Project Healthy Minds.
Wow. Well, thank you for those. Tell people, where do they follow you and your work, and where do we find Mentavi?
Sure. Well, you can reach us online at Mentavi, MENTAVI.com. Both the parent company, Mentavi Health, and the subsidiary company that I talked about, ADHD Online, are both available, have their own websites online. And you can reach me anytime at B. Herman, no dots, no underscore, just B. Herman, HERMAN, at Mentavi.com. And would welcome any interaction from any folks out there who share our vision of wanting to improve access and treatment.
Well, let me give one quick plug out there for our focused charity for this month. In fact, this is going over this month and the next, which is a returning champion of a previously highlighted charity. The Because organization, based in Philadelphia, is a local charity that helps those that are survivors of human trafficking, those that have, what makes them unique is that those who have already exited the toxic situation of being trafficked, oftentimes there's a dearth of services there for people as far as getting back into, or for the first time getting into the societal ways of meeting their needs medically, education, vocationally. And the Because organization helps people with that, as well as raising awareness. For the month of October and November, they're actually having a walk or run fundraiser that is a virtual, speaking of online. And so anyone in the world can join. You go on to their website, becauseorganization.org. And if you want to participate, you do the walking or the running in your own local area. And that's something that they do once a year. So we're trying to make sure we highlight that. They've been on the show before, the founder and medical director. So I want to put that out there. Go to becauseorganization.org to participate in that, or to share that event. As always, I like to mention it doesn't cost us anything to repost or share a link, so as we're probably on social media anyway. Well, Dr. Herman, thank you so much once again for being here, but also thank you so much for the work that you're doing to try to bring help to people to know themselves better and get treatment.
Appreciate that. It's been a pleasure talking with you, Dwight, and meeting you.
Thank you for listening to the Court and Parts Podcast Network. To listen to more Court and Parts shows, visit courtandarts.com.